hot in here.
It is hot in here.
Yeah.
Maybe because we're 40. We're having hot flashes. As it's recording. Maybe we're having a hot flash.
Maybe we are having a hot flash. It could happen.
Yes. It's
It
not
has
a fever,
happened.
though. It's not a fever.
No.
That's something different. Hot flashes are different.
As it's recording. Oh.
Can you turn that off?
You have to turn it all the way.
Oh, sorry.
It could happen. It has happened, isn't it?
It's very confusing. Okay.
All right.
Okay, we're going to give it just another minute as people pop in and join us. Thank you so much. We love seeing all the tiny little circular faces at the top of the screen. All right. We have a lot of things to talk about today, and hopefully you brought your questions too. Right? What a good time. Okay. How are we looking? What time is it?
I don't know, my watch turned off. 5:31, but we started like right at 5:30. Let's give it one more minute.
Yeah, we'll give it just a little bit more time.
I can't tell. 20, 28, yeah.
Yeah. Oh, hi from Minnesota. Hello. Hopefully I have my state abbreviations right.
That was Minnesota.
Right? Okay. Let's see what else we have. And it is kind of fun because we have people that join us from all over the place, so thank you so much. Hi, Mary. All right. We're just going to give it a little longer before we get started. Hello, Gail. Thanks for joining us again.
I got asked 3 different times this afternoon if we were going to be on TV tonight.
Oh,
Yeah, so
we're TV stars.
Yeah, we're famous now.
We feel famous. You guys make us feel famous, so thank you. All right.
Yes, it's Minnesota.
Oh, see, I know. Thanks, Pat. Like, yes, please spell out your state. So there's not too much effort. We have to learn counties also. Oh yeah, Destiny's going to share this too. We're learning all the county abbreviations while we're at it in Kansas. Kansas only. We're not good at other counties. Okay, Destiny's sharing it to the health department website just so that people can watch. Is that it?
Yeah.
Okay. All right, we've got about 50 people. Oh, hi, Brent. Yay, we are famous. We've got family doctors joining us from all over the place. Oh, yay. All right, and so we'll get started here in just a sec.
I shared it to my page. I couldn't do it to the health department. I think Cassie
can share it to the health department, hopefully. Okay. Yeah. So, as always, thank you guys so much for joining us tonight. I'm Jennifer Bacani McKinney, and I'm the Wilson County Health Officer.
And I'm Destiny Wheeler. I'm the Health Department Administrator. So.
And today we have new shirts, of course. Mm-hmm. Okay, let's reveal the great reveal, although they've already been on Facebook. But, you know, they look even cooler when they're on.
So, where there's a Wilco, there's a way.
Yay. And mine says, spread love, not viruses. All righty. Again, thank you to Shelby Smith for putting up with all the weird things we ask her to put on a t-shirt and not really judging us. So, okay, you guys, we're going to start off, and please post your questions. We'll keep track of everybody, and we'll try to get to everybody's questions. So, let's start off with the numbers.
Yeah, so Wilson County, still just one confirmed case, and who is recovered. And as of this afternoon, we have 129 negative tests. So that means 129 different people have been tested and all negative. So that's great. Kansas numbers, not quite as great. 2,025 positive cases with 107 deaths. So that's too bad. But we can do the national numbers too. So nationwide, we have 776,000 and some change, and 41,758 deaths as of, I think they do theirs at 4?
Yeah, 4
I think 4 o'clock from CDC.
All right.
So.
And hi, Mary. Thank you for joining us. Mary is a family doctor in Ohio. Fantastic. We love all the guests all the time. So one thing that we kind of have been really talking about a lot is what does, or I guess how severe is coronavirus? Because there is a lot of talk of, man, we're really going overboard. We're really, there's a lot of too much fanfare. Mm-hmm. Flu kills a lot of people. that is true. Flu kills a lot of people. One thing that we want to point out is, like, if we go through the numbers and we say, alrighty, so if we talk about a statistic we talk about is case fatality rate. So that is the number of people who die, who have confirmed coronavirus, over the number of people who have confirmed coronavirus. So that's how we calculate the case fatality rate. So this right now for Kansas, the case fatality rate is about 4.9%. In the United States, it's about 5.2%. And then if you think about our current influenza season, the case fatality rate for that is 0.1%. So we're talking about 5% versus 0.1%. And so you can see that that is a huge difference. And so some people say, well, you guys, what if we aren't confirming all of the people who have coronavirus? Okay, so let's say then that we only confirm 1 out of every 2 people. Right? So 2 people have it, only 1 person gets a confirmatory test. Well, that still means that we have a case fatality rate of about 2.5%, which is still much more than the 0.1% in flu season. Let's say we only confirm 1 out of 3 people, and we're still having people isolate and things like that. The case fatality rate at that point is still about 1.2%, and so you can see compared to 0.1%. So even if we're not catching all of the people that have coronavirus because of lack of testing or whatever else we're doing, it's still a really bad thing happening right now. And tell us more about influenza, Des.
So yeah, influenza. Not everyone gets tested for influenza either. Mm-hmm. The numbers from CDC all say estimate because they measure influenza-like illness. They have doctors all around the country that report influenza-like illness to a site called ILI-Net. So they do all that, and a flu season is always like 1920, 2021, because we know it's generally from around October till about March. So they estimate flu season to be 6 to 7 months long. So when we're talking about these cases and we see things like, oh, well, flu killed 36,000 people last year, maybe it did. It probably killed about 36,000 people in 6 months, but this specific disease has killed, almost 41,700 in 2.5 months that it's been in the U.S. So I know that everyone's really anxious to get back to their lives, and everyone's really anxious to do anything. Yeah,
anything
go places. Go. We've been hearing from lots of different people about opening pools and having the fair and all these things, and we want to do those things too. We just want to make sure that we're doing things safely. Mm-hmm. So yes, we've been very, very fortunate, and we've been very fortunate even in Kansas with 107 deaths because of these things that we're doing, these social distancing things. It's not all the media.
And we talk about, in public health, that if the things that we are doing work, then no one's going to notice. It's going to seem like we're overreacting. And we've said this before, but we just want to remind everybody, because if we don't do the things we need to do and people die, that's when we didn't react enough. And so we would much rather be accused any day of overreacting than not doing enough for all the people that we love.
Yeah.
So I think that's really important stuff to remember, that we want to get back to doing what we want to do, and those are the discussions that we're having now. Is what does it look like to reopen our state, our country, our county? The governor mentioned something today about that she most likely is not going to extend in Kansas our stay-home mandate past May 3rd.
Yeah, and so after May 3rd, it is up to us at the county level. Essentially, they're gonna hand us the guidance. Then they're gonna be like, here you go, take care of it.
Yes.
And
And we're going to do our best.
We're
not,
gonna do- yeah.
We promise. We're not like that mean. We're like a little mean. Look at us. Obviously, we're a little mean.
Obviously, yeah. We're scary.
Yes, but we want to get back to doing things. We want to get back to doing things safely. We mentioned we have the one positive case in Wilson County. We talked. We had a Facebook Live session on Thursday. Was that Thursday? Man, I don't know. Time is fast and slow at the same time. It's very weird these days. Oops, our battery is low. So we have our one positive case, and the thing that we can say is that the actions that were taken for that case, knowing what was going on, we found out at 4:00 that day. A press release was out by 4:30. We had a meeting with all of the parties involved by 5:00, and then after extensive discussion, I mean, we figured it out. I believe truly that is why we still have one case right now, and why people can rest easy in what went on, because all of the steps that we're taking up until this point have been in preparation for having that one case or the next case or the next case. We know it can happen. We know it probably will happen, and so that's why we've been working so hard. And we say we, not just us, you guys, in social distancing and wearing masks and not doing essential travel, that kind of stuff. So it all really is making a difference.
It is. And there was a question about the peak, if we're still expecting the peak next week. As far as what the epidemiologists at KDHE are predicting, is somewhere between the 24th and the 30th. So it is pushing it out a little bit, but that's good, because that means that social distancing is working.
Yeah, it's a great point. Social distancing doesn't make everything get over faster.
No, it doesn't make everything get over faster, but it makes it to where our healthcare system and our hospital workers can
handle.
Won't get overwhelmed.
Yeah.
Yeah. That we aren't going to run out of beds, and we aren't going to run out of tests, and we aren't going to run out of all of those things that we have to diagnose and treat the people that do need treatment, because we all know that some people won't need treatment.
And still, even though we know that 80% of the people who get this disease end up with mild disease, it's still a very contagious disease. There's a question about, will the warmer weather help with this? We don't believe so, because we know that it's happening in warmer climates. And so, I mean, if we're talking like hot, crazy weather, like with UV rays and stuff, well, you shouldn't be there anyways, because you might die, but along with the virus, so don't do that. But if we're talking about like what we expect in Kansas for warmer weather, then we don't think that that's going to make a difference. We don't know, but we don't see it in warmer places right now. And when we talk about reopening the county and the state and all that, just remember, just because we're reopening doesn't mean that it's still not as contagious. It's just as contagious as ever. It just means that people are going back out into our natural environments of work and the streets, out on the streets. I don't know if that's a way that we want to describe people, but it is how we're doing it. And so it's still just as contagious, but we have to continue to be careful.
I think half my family's on here.
Hey, which means it's half my family. I did see some of my family on here too. My actual
Your actual family?
Yeah, genetic family, but also your family, which is also my family. Thank you for the shout outs from Ohio and from New York. Dr. Price, we're actually going to ban you from the rest of these Facebook Lives. Just kidding. Everyone can read that on their own. And there's for my sister. Thank you to everyone that's made masks and donated masks. We had a lot of that. Let's see, social distancing. Ooh, thanks, Dr. Lou from Oregon there. And then, all right, let's see. And Marie, look at you guys from all over the country. Thank you. Dr. Ramos is here with us as well. And let's see, is it true that Kansas is at the bottom of the list of number of tests available per capita, and what is being done to make more available?
Luckily, our governor is kind of a spitfire, and she had on a press conference, there we go. She told us all that she had a meeting with the feds, And I don't know what she said, but she said enough that we got more tests. So yay! So yes, we were at the bottom of the pile for number of tests available, but
well, I would say number of tests done, right? Is that what or is it testing
well,
available?
we were getting bypassed for testing materials for bigger places, and she didn't like that, and so she fixed it.
All right.
So,
so that's what you get when your governor is all like,
yeah,
bring it. And
Yep.
then you get swabbed. Oh, speaking of swabs, and there's Dr. Stovak from Nevada. Speaking of swabs, we made, we I don't know if you noticed, but every once in a while we try to crack a joke. Not that this is a funny time. Actually, life is always funny in some way. So we're trying to find silver linings, and we're trying to give accurate information while still like not making it boring, because you can give information and not make, you can make totally normal faces, or you can make weird faces.
we're better at weird faces.
Yeah. So we made a comment about basically probing your brain with the nasal swab, the oropharyngeal swab, which is the coronavirus swab. You're not actually probing your brain. There was a question about if there was actual brain probing. No, we just want to say that it can be uncomfortable. Expect it to be uncomfortable. It's not painful. It's just not the most fun thing. There are a lot of things in medicine that are not fun, and we probe a lot of things. And this is not necessarily worse than other things that we probe. We won't get into all the probing. I'll probably just stop talking right now because I've said probe way too much.
Way too many times.
That's just a touchback on things we probe in medicine. On a scale of comfortable to uncomfortable. Okay. End scene. Okay.
There was one I was gonna. Oh, Eric asked about when the state mandates is released, does that mean businesses can reopen? So when she releases the state mandate, the stay-at-home mandate, the social distancing will still be in effect, and a lot of the decision making there will. Smallest doctor fingers.
Thanks, Janae. Smallest
Sorry.
doctor fingers in Wilson County. Yeah.
Anyway, sorry.
Okay,
sorry. So she's going to give guidelines, and what those guidelines are going to look like, we're not 100% sure, but we know that it will be downward trend of both influenza-like illness, which we mentioned just a little bit ago, downward trend in new cases every day, and widespread testing. We want to make sure that we can continue to test, because even though things are going to open up, this, like Jen said, it's not going to go away, and it's not going to be less contagious. So that will be, I would think, and like I say, we haven't exactly been told this yet, but I would think that's when probably Jennifer and I and your local governments, city and county, will get together, and we will kind of guide everyone through that process, is my assumption of how that's going to work.
We will say that so coronavirus or COVID-19 came to Kansas on March 6th. By March 9th, Destiny and I had already put together a county meeting for Wilson County. So we've been having those discussions with business owners, churches, hospitals, clinics, schools, government, ever since. And we meet every single week, and we email in between. And so we've had really good communication about what the future looks like, what's happening right now. And so this won't be anything new or surprising. We even just this Monday, yesterday, I know it's very confusing about the days. Mom. So we just talked yesterday about, we started the discussions about what it looks like to reopen businesses and to reopen our services even at the hospitals. So that's a good discussion that we've been having already, and we'll continue to have that as we go along. Yeah. We did, somebody asked, sorry, I just touched my nose, it was very itchy. Somebody asked about what reopening looks like, and if you do look at guidance on what's it called from the government?
Oh, making
Not-
opening America again. It's something about opening America.
Oh, opening guidelines, opening up America again. If you Google that, that is what the Trump administration has put out as far as guidelines. And we talk about, like what Destiny said, you know, that we have to see downward trends. We go through different phases of what are the kind of the easiest things to reopen safely, and that might be outdoor sporting events or not like big events, but like what was one of the examples?
The outdoor like parks and Neoshe,
yes.
or maybe letting like the boutiques and letting flower shops start delivering again, letting clothing stores do like online sales with curbside pickup and all that kind of thing that they're not really doing right now. Those kind of things. And Eric, I saw your comment, and I don't want to say I know because I have been working, but
you might repeat his comment.
He says it's getting hard to find rent money without being open, and
we feel you.
I can imagine. I mean, I
all over the world, all over the country and the world, this is the problem, and it doesn't make it easier that we're all like that. Everybody, like we have been working, that's true, but it doesn't make it easier that everybody's in it together, because it still is hard for everybody.
It is because when when you can't pay your rent, your landlord can't pay his mortgage, and I mean it's a whole community problem. We don't want everyone thinking that we don't see it and that we don't notice it, and that we're gonna like try and keep everything completely shut down till 2022, which I read somewhere.
Really? Wow.
Yeah.
We know that,
we don't want that to happen.
We know that even though COVID-19 is a health problem, we know that what it really is a physical health problem, mental health problem for everybody, whether you're ill or you're healthy and just trying to stay home. We know that it's a financial problem. We know it's an economic problem. So these are the things that we take into account when we're trying to make these decisions for the good of our community, not just health, even though that is our top priority, because we don't have businesses and we don't have schools and everything if people can't stay healthy. But we do take all of that into account in making these decisions. So we just want to let you know that one. I will say that another resource that is out there is something called the National Coronavirus Response, a Roadmap to Reopening, which is by the American, what is that other word there? Something with an E Institute. So there's some different guidelines out there that we're all using. So it's not just like one set of guidelines. We're all having conversations and we're reaching out to other people. So it's not just saying like, okay, Trump says to do this, so let's all do this. I mean, that might be fine, but we want to make sure that we're taking all of the ideas into account.
Yeah. So
That one, yeah.
There was a question about why there is a lag in KDHE's reporting, and the example was given that we had a case and it didn't come up till 2 days later. And the answer to that is private labs. If you'll notice, or if you look at KDHE's new cases every day, every Monday there's a spike, because private labs some smaller private labs don't report over the weekend. So it looks like yesterday at noon, they're saying we got 140 new cases, overnight, because
it was a wild weekend.
Yeah,
that's
but then today it was only 40 something, or around 40. But part of that is because part of them were over the weekend. They just didn't get reported to KDHE. So in the case of our positive, we got the hospital lab was notified by the lab, who reports to KDHE once a day. And since that didn't happen, we got the results around 4:00 on Wednesday, and then the lab, I guess, had to send it to KDHE, but it was after 11 o'clock when they sent it the next day, on Thursday, when they reported it to KDHE. And so then KDHE didn't get it on their report on Thursday, even though they probably were notified on Thursday. It was just after their report So it didn't go on till Friday.
Yep.
So, and I know one county in Kansas, the numbers are way off. Lyon County near Emporia, they have several outbreaks in, or clusters in a meat packaging plant, in there was a church cluster, there was, I can't remember, like a Hostess factory maybe, I'm not sure.
Oh, not my Twinkies.
Yeah, Twinkies.
So sad.
But their lab, I guess, wasn't reporting any to KDHE, so KDHE thinks they have like 30, and they're saying they have like 80. So there's some discrepancy there, but that's supposed to be being straightened out. So the short version of that is the labs are a little slower in reporting it to KDHE than they are to us.
All right. And as we go through questions and information, we also will help share some of your suggestions, such as open the borders to Canada and come fishing. Thanks, Robbie. We'll consider that one. And Dr. Price, yes, your wife has been social distancing from you for a very long time. She told me. We'll discuss later. All righty. And hello to Jay Flourish, class of 98 rules. All right. Okay, one thing, we talk about the other counties in Kansas. I think one example, if it's okay, we have friends out there in Dodge City and Ford County. They've got quite a big outbreak going on, and they've got one of their biggest obstacles, I think, or challenges has been they have processing plants out there in Dodge City, and so they saw a lot of people in those processing plants get infected, all at one time. So their numbers are quite a bit higher than what you would see in the rest of Western Kansas. The reason I bring this up is because even though we're talking about essential businesses and reopening and all that stuff, it all has to come with social distancing. It all has to come with safety, because even there, they are an essential business. They're producing food, and they're producing food for all of us. And not to be scared, because they're not showing that food is affected by coronavirus,
No,
which
I was
can't
gonna
be
say
transmitted
that.
that way.
Yeah.
Not transmitted that way. So even when we reopen, or even if we say okay, let's open this business, or let's open this public place, that hasn't been open, it doesn't mean that it's a free-for-all and everybody just shows up. Even now we talk about going to the grocery store or the hardware store, and there might be 30 people in there at once. We really have to be aware of that. Do you need to go in right then? Can you come back later and maybe go when there's only a few people in there? We really want people to be aware, because even though we're doing the things that are allowed, the things that we can do, I'm going to keep doing this also, the things we can do and are allowed, even though we can do them, doesn't mean we necessarily have to do them, or that we have to do them right then and there. So please be careful. And that applies to essential businesses, how we are able to keep our workers safe when we are trying to go back to doing the things we're supposed to do.
Yeah.
All right, that was a lot of stuff there. We had a question about
reinfection
rates.
Everything I've read on reinfection rates says there's not enough data.
It's true. Sorry, and we'll tell you when we don't know.
Yeah,
that's our
promise.
promise.
Everything that I've read is there just is not enough data, and there's also not widespread testing enough. Wide enough spread testing.
It's
I don't
also
know how to say that, but
it's a word jumble. You at home get to play along and put the words in the right order. This is so great. It's so interactive.
Yeah, we can't test enough.
Yes, but our Spitfire governor is going to help us test more.
Yep, she's working on it.
All right. See, we're giving shout outs to our governor and Secretary Norman. We think that our people are kind of badass in Kansas, but we can always do better. So let's keep it up and keep getting better.
There's a comment from Diane Schaefer, and says Casey says they should have self-serve coffee again when they get the okay, and she said baby steps, which is the perfect way to explain how opening back up is going to happen. It's how it closed it down. Now, granted, we were kind of in a hurry when things closed down. Things happened pretty quickly, so they were bigger baby steps than
like
we'll
large
probably,
babies.
Yeah,
I had a large baby. You had large babies.
No, I had little babies.
Well, little
just
babies
lots
at
a
once.
time.
Yes. Multiple.
Yeah. And so the order that things close down in is pretty much the opposite order they'll open up in, is my guess.
And it's kind of, I mean, the same way to think about like the people, right? So in these phases of reopening, we see that we're still doing everything we can to protect our most vulnerable populations. So that's like assisted living, nursing homes, things like that. Wherever my parents live, again, the really old people. I don't see my mom on here, so
you're gonna be in trouble.
She'll yell at me later. I still get grounded. Okay. There was a question earlier that somebody asked before we started about gloves. Should I be wearing gloves to the grocery store, to Dollar General? The answer would be no. Our gloves are only as clean as the things that we touch. And so if you're going to be touching everything just like you would touch your hands, touch with your hands, touching money, touching whatever everybody else has touched, shopping carts, it's the same. You go home, you might as well just go home and wash your hands. You know, you can wear gloves. Just remember, it's not it's not more secure. You could reach up and touch your face or your nose with gloves on, and you're just as at risk as if you did it without your gloves on. So just remember, we're not recommending gloves, but just because they can be lead to a false sense of security. Yeah. Let's see. Oh, okay. There's a lot of, how about this one? Conspiracy theory. This is a little bit of Mr. Burns' Simpsons here. I think he used to say excellent.
Oh, yes.
So,
I thought you were talking about Mr. Burns.
Oh, not our economics teacher, right? I wasn't good at that. Okay, so conspiracy a little bit. Not really conspiracy. I say that in a joking way, but a lot of people say, well, I'm pretty sure I had it already, and like I'm pretty sure I have antibodies. We need antibody testing. We'll talk about that in a second, but. What I want to say about that is we don't know. I mean, people potentially, maybe, I don't know. We don't really early on. We didn't think that was a possibility. It's very unlikely that we had little pockets of coronavirus without it being widespread, because we've seen how quickly it spreads now. But even if you think maybe I had coronavirus, maybe I'm immune, don't go with that, because we don't know enough about COVID-19 to know what kind of immune response that we mount. We don't know how long those antibodies stick around. We don't know if you are exposed once, if you can be reinfected, just like Destiny said. So even if you're thinking that, great, and hopefully you're more protected, but don't count on it, please. Do the things that we know already that help, and that is social distancing. Alrighty. Sorry if anybody, I see some hearts and thumbs up. So hopefully somebody out there either knows Mr. Burns, our econ teacher, or agrees with us. Okay.
Tell him we gave him a shout out.
Yes, thanks, Mr. Burns. Sorry, is that okay if I go with antibody testing for a second? I'm gonna go this is Mr. Dollar's science class or whatever. Did we do antibodies? Or maybe this was college, I don't even know. It all blurs together. Okay, antibodies. So, people ask about antibody testing and why we're not doing it or whether we should be doing it. The problem is, at this point, so antibodies are the cells that our body produces to try to, low battery. The cells that our body produces to, through our immune system to try to form protection against invaders like bacteria or viruses. And so, they then trigger our bodies to attack an invader or prevent a disease from happening or prevent it from being as bad as it could be. So we have these things that are in the body, antibodies. They're called immunoglobulins. I'm only saying that not for testing purposes, but just in case you hear that out there.
Makes her feel smarter.
It makes me feel really smart. You do that through a blood test, not through a brain probing. Just kidding. Just making sure you're paying attention. We don't probe your brain. Okay. And then so the problem is though that we don't know enough about the virus. Like I said, what do your antibodies levels look like? How long do your antibodies stick around? Like how does everybody produce antibodies when they get infected? What if you don't show up with antibodies in your blood? Does that mean that you didn't have the infection or it's just early in the infection? So that's kind of what the problem is. We've seen in other countries that people who were severely ill, some of them didn't even produce antibodies. So there's just not enough information out there to know about antibodies. And so we don't know the accuracy. They also can detect some of the other coronaviruses that are the common ones that are around every year that cause common cold. And so that's where we are in not knowing if antibody testing is the right thing at this point. We hope, information is going so quickly. So we hope that we have that kind of technology soon. And when we do, and it's reliable, then we will jump right on that. We in Wilson County are all about getting stuff done, and like our self-reporting system, for example. Yep. We'll break out all the good technology and be prepared. Yeah. You want to put in a plug for self-reporting?
Yeah, so we have self-reporting.
Yeah, I don't know if you heard that before, but we do. Report away, people.
Yeah, we've had, I think, 4 different people report. Luckily, none of them were positive.
Yeah.
But it is on the Wilson County website. It's on our Facebook page. It's on both hospital websites and both city websites in Fredonia and Neodesha. So if you are worried that you might have been exposed, just hop on there. It takes like 3 minutes. The email goes to Kara, and it gives her something to do. So,
not that she's bored. At this
she's
point,
not bored.
But,
She's not bored right now.
Okay, prior infection. So, we had a comment from Dr. Liu out in Oregon that social distancing also not only protects you, but also allows our healthcare workers to preserve PPE, right? Personal protective equipment. So when we have you call first and call the clinic or call the hospital first before you're tested or whatever else, we can prepare accordingly. And so we know whether to gown up completely or if we can just use another mask. So as much information as you can give us before you arrive at the clinic or the hospital or at the health department, please call ahead and let us know so we can protect healthcare workers as well as you.
So there's a comment that says, I'm watching the news and they now have Wilson County back to no cases. I haven't seen them take away cases. So what they're meaning is that we have no active cases right now, and we don't, because our case recovered. The cases as we report them are cumulative, so we'll never go down unless someone's accidentally been added to our list, which has happened. So we will continue to go up if we have another case. We'll have 2 cases, and when that person recovers, we'll still have 2 cases. So it's just how many cases we've had.
And somebody asked about contact tracing. Are we already doing that in Kansas and in Wilson County? Absolutely. Yeah. That health department is right all over it. Yep. So they're doing a great job. And again, I always want to give a shout out to our health department. They have 4 mighty women in that place, and we have 6. Like, we have 4 full-time. Oh, 4 full-time. Sorry.
We have 4 full-time people, but our part-time people are awesome too.
Yes.
We have 2 part-timers.
So they're like doing a great job with like you would think that we have 1,000 people in our health department. They're very mighty.
We're that good.
Yeah, they're that good. All righty. Oh, hello. Oh, hi, Megan. All right. See, you guys from Wilson County, we're in good company from people all over the country. So thank you. All over the state and all over the country. Awesome. I think one thing that we want to comment on is just, there's a lot of back and forth on mass gatherings. Should we do it? Is it constitutional? Is it blah, 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 blah? Like, so let's talk about that for a second, right? Because we're like real talk here, we're not holding back. So we believe that we should stick with the 10 people or less mass gatherings, right? Because we know that when people gather in bigger clusters, that's where we see outbreaks. We've seen that in Kansas City, where there have been outbreaks linked to large church gatherings, and not to put churches on the spot, that just is factual. That's what happened.
Just like the factories.
Yep,
and
just like the factories.
Anywhere.
Nursing homes also. Yeah, so anytime that people are gathered together, we know that there's a higher infection rate. So that's why we would support that. We think that people should limit the size of their gatherings. So I say that because the governor has put out mandates to say that applies to everyone across the board, and so but then people have challenged that as well. And I see my little pictures here that I have on my little piece of paper of people at these rallies and people protesting that they don't want to stay home, that they have rights and all this stuff. Nowhere along the way do we feel like anyone is trying to take away anyone's rights, whether it's the right to bear arms. Man, I've heard of people stockpiling ammunition. Go for it. I don't care. Do whatever you want to do. the right to exercise your freedom of religion, and like do it. We've seen amazing things happen with how we are sharing our religious beliefs throughout this whole pandemic, and it's really reached out to even more people. Like, people can sit on their couch and hear really good messages from people, that they, or churches or whatever, people that they follow, and it's been really wonderful. So there's nothing about freedom that is happening. The bad guy here, as we talked about maybe at the very beginning, is coronavirus. Like, coronavirus is the jerk, not anybody else. Well, we don't have that shirt, do we?
No, okay. Viruses are jerks.
Viruses are jerks. so it's not the government. It's not the people that are making these rules. These rules are what have been found to work in other countries and other states. So please remember that viruses are jerks. People don't have to be, right?
Yep. There is a question from Dr. Price. Are we worried that people will get a false sense of security from wearing masks and relax their social distancing efforts? And yeah. Yeah, that's why we were trying to be really, really specific when we talk about what masks protect whom. That when you wear a cloth mask, it's not to protect you. You still have to keep your distance, because you still have to not touch your face and wash your hands and do all that. That is to keep your droplets to yourself and not infect someone else in case you're an asymptomatic carrier. I watched our video from Thursday, and we mentioned that we were nagging on the same things, and that's one of the things that we've kind of been nagging on is, and it's not that we're like think you guys are doing bad, because I really think that everyone is really trying to do their best. And I think that us having one case really, really spotlights that, that everyone is really, really trying hard. But we want to be real with you guys, and we don't want you guys to think, oh, well, I have a bandana on, I can
go wherever
I want and touch whoever I want and whatever, and I'm safe, and that's not the case.
Only the N95 masks, or more than that. Like, I mean, there's full get-ups. Like, and I, we have our friends out in New York that are really doing some hard work out there, and we know that their hospitals have been overwhelmed, and people wear these masks and these full PPE, helmets, everything for, a 12-hour shift, and that can't be fun at all. But we do reserve those things for healthcare workers, because those are the only things that are going to protect people, protect anybody from other people's droplets. And we potentially have to be in there, intubating people, which means putting a tube down their throat to help them breathe. And you can't do that from farther away than right here. So we have to help protect ourselves with that. And then we also have to be able to know that our people can go in, monitor people closely, and we have all the protective gear that we might need. So thank you. Let's see, are the only ones wearing masks are the people concerned about their own safety, and masks don't help the ones wearing them. So Debbie, it's a great point that if it would protect, in theory, it would protect everybody as a whole in a community if everyone was wearing masks, because then nobody's droplets would get on anything, and then we wouldn't have anything to touch that has their droplets on it, yada yada. So that's the ideal world, and that's why we want to encourage everybody to wear masks. We have masks that are for free that Mrs. Githens made, and other people in town.
In the blessing boxes.
Yeah. So they're just sitting there in the blessing boxes, and you can just take them, and it's great.
Yeah, and it's kind of embarrassing the first time you wear a mask into the store.
It's a little weirdish.
It is. The first time I wore one, I'm like, oh gosh, I'm going to put this mask on. But there were a bunch of people wearing them that day. And then it is a habit that you have to get into. Today, I walked to the hardware store from the health department and picked up onion sets and forgot my mask. And I felt really bad about it, because I was like, oh, here I am telling people to wear masks. I don't have a mask on. Yes. But we get into the habit of it. Everyone, and like I said, everyone's trying.
And we're in it for the long haul, right? Like, this is what we're doing, and it's not like we're gonna be like this forever. We're talking about the stay-home mandate reopening and all that, but we are in it for the long haul. So the masks that we're wearing, please get used to it. Please keep wearing them because that's going to help us through the next month and the next month after that and next month. We don't mean to make it sound like it's forever, but this is not going to go away anytime soon, and we want to keep people safe as long as possible. What was I going to say about something there? Mask. Oh, somebody asked about if you could explain contact tracing. I also would like Destiny to explain what an onion set is.
It's what you plant.
It is?
When you grow an onion.
A set?
Onion set. Because you set it in the ground, I guess.
I don't know.
I'm new to this. I'm new to this garden thing.
Set a beer on the ground.
I just know that's what they're called. Okay, contact tracing. Contact tracing is when we... And we do this at the health department with every infectious disease. Like, one of the big things that the health department does that no one sees unless you... Oh my, look at my hair. It's like sticking straight up.
It looks great.
It was sticking straight up.
Oh, okay. It's just windy in here.
Yeah, so one of the things that the health department does that no one really sees unless you have an infectious disease, a reportable disease, is contact tracing and disease investigation. So if we have someone who shows up with, I'm trying to think of a good one.
An STD.
Cholera.
Oh.
If we have someone that shows up with cholera, which does happen in the United States
there was a
still.
whole movie made about love in the time of cholera. A book, and then a movie. Is that weird? It's diarrhea.
Really?
Yeah.
Yeah.
Let's move
Cholera
on.
is gross.
Yeah.
But so if someone in Wilson County were to get cholera, we would get notified through the state lab, and we would have to contact that person and make sure they hadn't been around anyone else who had those same symptoms, and anyone that they had contact with. And in this case, it's a little bit different because we would contact the people that weren't sick yet, and we would give them quarantine instructions and things like that. So say, just to throw a hypothetical out there,
Do it, yeah.
Jennifer has someone in her office, and they walk in without calling, and they get put in a room, and 2 med aides and the receptionist and Jennifer all see them for more than 10 minutes, and then they turn out to be COVID positive. Then we get a hold of first the person who is sick, and then we get a hold of Jennifer and the 2 med aides and the receptionist, and we put them all in quarantine, and we monitor their symptoms every day. And if one of them gets sick, then we have to find out who they were around for the 16 days before they got sick, and all those people get put into quarantine. Mm-hmm. So that's contact tracing. Mm-hmm. You start from the sick person, and you go back to where they may have gotten it, and you go forward to where they may spread it, and you just keep an eye on everybody. That's what CARE's doing these days.
Yep.
So self-report something, so she has something to do.
Mayor Bob gives a hashtag of Oregon Trail, if anyone is familiar with that. They all
dysentery.
Had
they all died of dysentery.
Yeah, they did. It was really, it was very depressing. Like, of all the video games we had, they were all very depressing.
Yeah.
Okay. Glad we made it out of that era. Oh, onion sets. Okay. Always an ag teacher. Thanks, Kelly. Onion sets are from the previous season, whereas onion transplants or plants are from the current year. See, I did not know this, and now we all know. Cholera, onion sets. Is this not the best one-stop shopping for all your educational needs? It is. Okay.
We're learning things, people.
Oh my gosh. Dr. Price? Nope, not going to read that one. Okay. Kelly, you also asked if we thought there would be a tracking system in place, like they have in other areas where you have to check in wherever you go with your own personal QR code. I don't believe so. Now, I put a tracking device in Destiny because I need to know where she is all the time. we called it. What are those things? Those think about it later.
I don't know.
You know that you put birth control in the arms.
Oh.
Just joking.
Oh, like a Mirena, or no, Mirena's an IUD.
No, the other, why am I blanking? One of my doctor people tell me what I'm thinking. Okay, so I don't know about tracking devices, but they are doing a lot of information as far as like cell phone tracking. And so that's kind of, well, not tracking. Well, maybe tracking.
Kind of tracking. Yeah. If you're checking in with a QR code everywhere you go, it is tracking. Snake bite.
Replying to Bob.
Oh.
Say bye. And I do want to say, Jill Gillette, thank you also for making masks. She mentioned there are 500 or so, over 500 masks that are Nexplanon. Oh my gosh, thanks, Lacey. I just blanked. It's because we're TV stars and we're like, line, please, line. Our director's not here today. No. So, but anyways,
it's obvious we don't have a script.
Yeah, sorry. What were you saying about contact tracing? Oh, Jill Gillette, 500 plus masks in Wilson County. So you guys are amazing. Awesome. Like, they're out there. They are definitely out there. All right. Oh, and Dr. Redfield cautioned today an outbreak this winter could be even worse than this one. Doesn't our new normal have to include daily mask distancing and washing hands for the next several months? Absolutely. This is, like we said, this is for the long haul. We're doing all these things to keep each other safe. It's not necessarily to shorten the length of what's going on, like we mentioned, but just to keep each other safe. Masks, social distancing, good hand hygiene. In general, like, good hand hygiene is just a good thing. I think there are a lot more people, it's less likely to have somebody like walk out of a bathroom not washing their hands. We saw that before. I mean, now it's like less.
I'm sure
of that.
We see it now.
I know, but like, it shouldn't be. It's still so gross, even when there's not a pandemic. Wash your hands, people. It's just important stuff. Alrighty. What else do we have here? How are we looking on time? Oh, yeah,
we're almost at an hour.
All right, we're almost at an hour. We're gonna do our last call for questions. Please feel free to throw those out there. And again, we want to thank everybody that comes in and asks questions. When you guys ask questions, that helps somebody else that's at home wondering that same question. So no question is stupid. No question is too basic as far as coronavirus. Nothing. There are some that are too complicated. We may not know that. Antibody testing is about as far as we go. No, we will welcome any question. If we don't have the answer, we will get the answer for you as well. Please advise everyone to wash their cloth masks often. See, I can be serious. Thanks, Dr. Price. Very true. Wash your face mask, your cloth mask, your handkerchief, whatever, because it's only as helpful as clean as it is, Yeah. And just be careful when you're taking it off. Also, that like if somebody's up in your business and they're like talking to you and the droplets hit here, you don't want to be touching that business and then
no,
that's a lot of business.
That's
a lot of business.
Too much business in your business.
In your business, up in your business. All right, we'll move on from that one too.
Should we tell them about the Secretary Norman thing? That's kind of fun.
Yes. Okay, we kind of get really excited about stuff. I don't know if you noticed this. Okay, can we say? Okay. Yeah, okay. So Secretary Norman is our Secretary of Health, the Secretary of the KDHE here. So the senior person for the PR part of the KDHE, she reached out to us, and we soon will be doing a little session with Secretary Norman, me, and Destiny, just the three of us. We're super excited.
Yes, a little like Q&A, so
yes.
we can talk about how this affects rural areas of the state and kind of what our challenges are, and